Chronic obstructive pulmonary disease, COPD. Chronic obstructive pulmonary disease, COPD, is a term for lung and airway diseases that restrict your breathing. People with COPD have airway inflammation and scarring, damage to the air sacs in their lungs or both. Emphysema and chronic bronchitis are both forms of COPD. Treatments can manage symptoms and reduce exacerbations. What is chronic obstructive pulmonary disease, COPD? Chronic obstructive pulmonary disease, COPD, is a term for certain types of irreversible lung and airway damage that block, obstruct, your airways and make it hard to breathe. If you're diagnosed with either emphysema or chronic bronchitis, you have COPD. Changes in your lungs and airways in COPD include loss of elasticity in your airways and air sacs in your lungs, alveoli inflammation, scarring, fibrosis, and narrowing of your airways. Thick mucus in your airways. Destruction of the walls between your alveoli. This enlarges them and traps air. People with COPD often get exacerbations, or worsening of symptoms, like severe difficulty breathing, thicker mucus, wheezing and cough. You might need to go to the hospital for severe exacerbations. COPD gets progressively worse over time. Flare-ups get more severe and happen more often. This usually takes years or decades, though some people get worse faster. Types of chronic obstructive pulmonary disease, COPD includes both emphysema and chronic bronchitis. People with COPD often have features of both. Emphysema is when your alveoli become damaged and enlarged. The most common symptom is shortness of breath, dyspnea. Chronic bronchitis is inflammation in your large airways. This narrows your airways and makes lots of mucus. Cough is the most common symptom. Symptoms and causes. Symptoms of COPD include cough with mucus that you've had for a long time, for 3 months or longer at a time for at least 2 years. Difficulty taking a deep breath. Shortness of breath, especially when performing daily activities or with mild exertion. Wheezing or other lung sounds. Barrel-shaped chest. Bluish skin, cyanosis. What causes COPD? Damage to your lungs from smoking is the most common cause of COPD. Other causes include alpha-1 antitrypsin deficiency, alpha-1, a genetic disorder that can lead to lung damage. Secondhand smoke. Air pollution. Exposure to dust and fumes from your job or hobbies. What are the risk factors for this condition? While smoking is the biggest risk factor for COPD, not everyone who smokes will develop it. You may be at higher risk for COPD if you are female, are over the age of 65, have been exposed to air pollution, have worked with chemicals, dust or fumes, have alpha-1 antitrypsin deficiency, had many respiratory infections during childhood. What are the complications of COPD? COPD can trap bacteria in your lungs, leading to infections. It can also prevent oxygen from getting into your body and carbon dioxide from getting out. This can lead to serious complications, including pneumonia. High levels of carbon dioxide in your blood, hypercapnia. Low levels of oxygen in your blood, hypoxemia. Respiratory failure. Pulmonary hypertension. Right-sided heart failure, cor pulmonale. Collapsed lung, pneumothorax. Polycythemia, making too many red blood cells. How is chronic obstructive pulmonary disease, COPD, diagnosed? To diagnose COPD, a provider will perform an exam and ask you about your health history. They'll test how well your lungs work and might get images of your lungs. They may ask you questions like, Do you smoke or have you ever smoked? Have you had long-term exposure to dust or air pollutants? Do other members of your family have COPD, other lung conditions or liver disease? Do you get short of breath with exercise? When resting? Have you been coughing or wheezing for a long time? Do you cough up phlegm? What are the stages of COPD? Your provider can stage COPD based on your forced expiratory volume in 1 second, FEV1, results. FEV1 is the amount of air you can breathe out in 1 second, and it can tell your provider how blocked your airways are. Your provider measures FEV1 with spirometry. COPD stages based on severity are: Stage 1, FEV1 is 80 or above. Stage 2, FEV1 is between 50 and 79. Stage 3, FEV1 is between 30 and 49. Stage 4, FEV1 is less than 30. Your provider can also evaluate your symptoms and your risk for exacerbation using groupings with the letters A, B and E. A, you have mild symptoms and a low risk for exacerbations. B, you have more severe symptoms and a low risk for exacerbations. E, you have a high risk for exacerbations. Your stage isn't directly related to your symptoms. For instance, you could be in stage 3 or 4 but still have mild symptoms. Your provider can use your stage, symptoms and number of exacerbations to guide your treatment. Management and treatment. There's no medical cure for COPD. Treatment focuses on improving your symptoms and reducing and treating exacerbations. Your provider may recommend, but the only existing cure is with natural roots and herbs. If you are suffering from this disease, you can contact drofenmu@gmail.com or visit https://drofenmu.simdiff.com/take care of your body. It's the only place you have to live in.